Hi, my name is Dr. Kevin Mao, physical therapist, and with me today is my wife Twee. And together we own and operate Balance and Body Restoration Physical Therapy Massage, which is a clinic located in the East Bay of California in a town called Dublin. Now, at our clinic, we specialize in working with people who are struggling from chronic pain and injury. And then one of the most common injuries that we've been seeing over the past couple of years is something known as plantar fasciitis. Now, plantar fasciitis is quite a painful and sometimes very debilitating condition which creates pain and inflammation on these soft tissue structures on the bottom of the foot, specifically as it connects onto the back of the heel. And most patients that seem to struggle with the condition have a lot of difficulty, especially getting out of bed in the morning. There's a lot of sharp pain on the heel. It's just very, people are very hesitant to be able to put their foot down those first couple steps in the morning. And it just seems to take several steps just for the foot to start to loosen up. And that pain and tightness just seems to linger over the course of the day for some patients. And there's a lot of people that also struggle getting out of a chair, especially after a long period of sitting. And it's just something that seems to prevent people from being able to do things like go on long walks. It's difficult to be able to go outside and jog or run. And it also holds people back from being able to do recreational sport and activities such as tennis or badminton or anything that just involves a lot of impact on the foot and a lot of impact on the heel. So in this video, what I'm going to share with you today is our approach for how we help our patients be able to heal and recover from this condition, just so you have a better idea of the types of things that you should look out for if you're trying to heal from this condition on your own. And again, just to give you some tips and advice that seems to help a lot of our patients here in the clinic, with the hopes that it helps those of you who are out there who are looking for this type of advice out here on the internet. So with that said, let's get into the first part of this video. So the first thing that I wanted to talk about before we just jump right into a bunch of stretches and exercise is this concept of stages of rehabilitation. Now, for a lot of our patients that are struggling with the condition, they just don't realize that this is a condition that usually takes several months or sometimes even up to a couple years to build up. And when they're at the point where they're actually struggling with pain, a lot of the treatments they do is just kind of reactionary. Either they try a couple stretches here and there, they might try like a couple of anti-inflammatories, or they might try to change their shoe wear. And for a lot of patients, that just one or two interventions just doesn't seem to be enough, and it's just a very difficult process for them just to be able to find solutions. However, when we start to approach this condition from being able to see it from different stages of rehabilitation and just to tackle this condition on from a much more strategic and comprehensive fashion, this increases the chances for our patients to not only be able to get more rapid pain relief, but also sustain progress over a long period of time. So the first video, we're going to share with you the very first stage of rehabilitation, which is just a very simple range of motion assessment of the ankle. Okay, so phase one of rehab is to teach you how to do a very simple range of motion assessment of the ankle. Now, I would say that probably 90 to even up to 95% of patients that I see with this condition, when we assess them, seem to have some type of stiffness, some type of immobility, or some type of, again, loss of range of motion on their painful ankle relative to the other ankle. This is usually due to a couple of different factors. Either the person had an old ankle injury that they never really dealt with, or they had been dealing with something like tight calf muscles that they kind of always knew they had, but you never really did anything about it to actually fix it. Or they just kind of dealt with this kind of chronic foot and ankle stiffness that they just kind of pushed through over the years, but at some point it starts to catch up to them in the form of, again, this kind of sharp pain and inflammation at the base of the heel. So what I want to show you before we jump right into any various forms of stretches or exercises is just to teach you how to assess, do you have a range of motion restriction in the ankle? And if you do, we would then share with you some strategies to share how to actually resolve that issue. So the first thing we want to do is just kind of measure a line about 4 inches from your big toe to the wall. And we just use a pen here because 4 inches is about a third of the way, kind of into the pen. And what you want to do here, as Twee is going to demonstrate, is you want to see if you're able to touch your knee all the way to the wall while also making sure that your heel stays flat on the floor. So if your heel comes up, that means you have some type of range of motion restriction in the ankle. And if you're not able to fully touch, that also means that you have some form of restriction. Now, go and demonstrate on the other side, Twee. Now, we want to make sure that you are able to keep your knee aligned over your toe, and also, again, make sure your heel is staying flat on the floor. And it's not important if you're not able to kind of go all the way and able to touch on both sides. What's more important is that we're able to detect to see if there are any noticeable asymmetries in the range of motion, meaning if your painful side is way more restricted than the next, then that is something that we absolutely want to make sure that we're addressing in our rehab. So let me just show it from the test from a different angle. So Twee, go ahead and demonstrate the right foot again. So again, she's just going to, again, go knee to the wall. And Twee, go ahead and bring your knee in towards the midline here. So I would also say that the second mistake that people make is that when they have a really tight or very stiff ankle, their knee can kind of cross over towards the pen and cross over midline. This is a very common compensation going to ease back when somebody has very stiff ankles. So you want to make sure that as you're doing this, that the knee does not cross over the midline towards the pen. So go ahead and demonstrate it correctly again, Tweet. So as you can see here, her knee is not kind of crossing over towards the pen. It's kind of just staying kind of, again, to the right of the pen. Let's just show it one more time on the left side, Tweet. So we'll just show it again on the left side here. So heel is going to stay flat on the floor. And again, if you start to notice your knees kind of crossing towards the midline, try to just kind of direct it back over your foot, like so. Exactly. So that's, again, a proper range of motion of the ankle, making sure that the ankle is staying in what's called a neutral foot or a neutral plane, and make sure that that knee isn't compensating by crossing over the midline. So, so that's it for the range of motion test of the ankle. And then from there, if we have identified that you actually have some type of tightness or stiffness or loss of range of motion, the next phase is going to teach you a couple of different drills or exercises that you can start to do to make sure that we are restoring that proper range of motion over time. So let's get into the next video. Okay, so this is entering phase 2 of rehabilitation, and this phase is what we call range of motion restoration of the ankle. Again, we're going to assume that after you did the ankle mobility test that we might have identified that one ankle is a lot tighter or a lot stiffer than the other. So we want to show you a couple of exercises to help you safely increase that range of motion just to restore the normal mechanics of the foot and the ankle to teach you how to be able to take pressure off of that heel so they can start to heal on its own. So this exercise is very similar to the test that we did. It's just that we're not going to kind of have you go all the way, into your full limits. So go ahead and demonstrate a couple times, Tweet. So all you want to do here is just kind of pump the knee over the toe, and just our goal is just to get that joint moving. A lot of people that have this condition have just spent a lot of time sitting. They just haven't really practiced a lot of ankle mobility work over time. And a lot of people are just unaware that they've kind of lost that range of motion. Maybe the joint starts to get stiff, maybe the muscles start to get tight. But just by doing something like this, you just start to just wake up a lot of those joint receptors. You start to get a little bit of kind of natural lubrication from the natural joint juice that just seems to circulate within each joint. And just by getting that fluid pumping, you're able to start to just kind of loosen up those joints over time. Now, the most important thing that I want you to look out for when you're doing this exercise is to make sure that if you start to experience any pain on the front or on the top of the ankle, then make sure you don't push through that pain. Go and switch sides, Sweep. That is something that is called ankle impingement, where essentially the shin bone is just trying to just pretty much compress the ankle bone on the bottom of your foot. So again, if you start to feel any pain when you're doing this on the front or on the top of the ankle, that's okay. Just make sure you're not pushing through that pain. Just try to ease back to make sure that you're working with a much more kind of pain-free range of motion, okay? So just practice it a couple more times, and we're just kind of after looking for 12 to 15 repetitions, especially for the first couple sets. We're not trying to do anything too aggressive, especially in the beginning. All right, so let's go and switch sides, Sweep. And I think it's very important for you to practice this drill on both ankles as well. I recommend either doing 2 sets on the stiff side and 1 set on the other, or you can also do something like a 2 to 3 ratio in terms of sets. And in the second set, what you can do, if you start to notice that the ankle is starting to get a little looser, it's starting to be able to move a little bit easier, is then you can start to kind of push the range of motion limits a little bit further, just to make sure, again, you're not having any pain on your heel, you're not pushing through any impingement on the front or top of the ankle. And again, just make sure that the motion is pretty much as pain-free as possible. Again, first time you do this, you just might start to feel a lot of tightness or a lot of restriction. And this is something that really starts to benefit you as you practice it over the course of several days. especially if you have a lot of range of motion restriction that you need to work through. All right, so that is exercise number 1, which is just a very simple range of motion drill. Okay, so the second simple ankle mobility drill that you can do, and this I would say it would be more for just a beginner person, especially if just putting your foot on the floor or just kind of loading your knee over your toe is just a little bit too much for you. I think that this particular stretch can be used for anybody at any stage of their rehab process for their plantar fasciitis. Again, this is just a way for you to very simply start to explore some of the mobility within the joint and just some of the joint angles that you may not have been doing for even up to a couple of years. It's just a very quick and easy way for you to just get some good stretching, good health, good motion within the joint in a way that's going to be very low stress and low strain on the heel and on your calf as well. So Tweet, go and show the ankle circle on your right foot. So what Tweet here is just, she's going to just do a very, very, very slow circle of her foot and just trying to make as big of a circle as possible. All right. We want to make sure that she's exploring the full range, especially pull when you get to the top there. Try to pull your toes and pull your toes all the way up towards you as much as you can, and just kind of complete the circle as well. Okay. A lot of people that end up with this condition in our clinic just haven't really explored a lot of the range of motion in their ankle. Let's try to go the other side. And so 3 one way is good, and followed by 3 the other way. And again, the goal is just to do these as slowly and as controlled as possible. And after a couple of times, you're going to start to feel some fatigue. You're going to start to feel definitely some activation within those muscles. But again, we're getting a lot of good just joint mobility in the ankle, essentially for free, with not that much stress on the heel or on the foot itself. Let's show one more time on the left foot now. So she's going to do the same thing. Again, very simple, just a couple of simple ankle circles is all you really need to do. Again, perfect beginner exercise for someone that might be in a lot of pain and just needs somewhere to start. So 3 one way, and let's go 3 the other way. You can start with 3, you can work up to 5. I would definitely recommend trying to do this definitely on both feet. Maybe you can do 2 sets on the painful foot and 1 set on the non-painful foot. Okay, so that's it for the second joint mobility drill. Easy enough to do, but very effective when done consistently. Okay, so the next thing I want to show you is how to perform your very own soft tissue release of the structures on the bottom of the foot. So a lot of people aren't aware of the plantar fascia is not just at the point at where it hurts on the heel. It is actually a very dense and thick soft tissue structure that lines the entire bottom of the foot. And what we end up realizing for a lot of patients is that they also seem to have a lot of tightness and a lot of adhesions of some of those soft tissue structures on the bottom of the heel. They want to use something that we have here, this little wooden foot massager thing, just to help you break up some of those adhesions. Again, you can use something like a lacrosse ball. You can use like a softball or anything, or even one of those kind of spiky balls that you might find on the internet. That is kind of what you can use for something like this. We just happen to have this thing here, which is just again a little bit more specially designed for the foot. So Tweet, go ahead and demonstrate. So for here, she's just going to just kind of roll her foot over this roller device here, just making sure that she's not putting too much pressure on the painful point on the heel. And again, the goal is just to get some just self-massage of those structures in the bottom of the foot, just to help break up some of the tightness, break up some of the adhesions, just to give that plantar fascia a little bit more pliability so it's able to absorb a lot more shock, and so that the pressure isn't all just kind of forcing itself kind of right on the heel where it's most hurting. Okay, so again, I'd recommend that you don't roll right on the painful spot of where you feel the pain. Just kind of work on the base of the foot, just kind of work on kind of the palm of the foot, and just kind of work on it as much as you can. Okay, go and switch sides. Again, we happen to have this wooden foot massager thing here that you can kind of look for on your own if you want. But I believe just using a lacrosse ball, using any type of trigger point ball, that is kind of what you want to do with this. It's pretty self-explanatory, but it's just, again, a thing that a lot of people just kind of overlook, or they just may not be knowing that they can do something like this. And again, the goal isn't this isn't something that's going to just kind of get rid of your pain all at once. This is just something to practice, for a couple minutes over the course of many, many days. And at some point, it's one of the things that can really help you heal over a longer course of time. So that's it for self-massage of the structures of the bottom of the foot. Let's show you the next thing that you can do. Okay, so we've just showed you a couple of ways where you can start to increase the joint mobility within your ankle. And now I want to show you how to address the problematic muscle known as the calf muscle. So the calf muscle is a muscle that attaches from the back of your knee all the way down into your heel, and it starts onto your heel via this thing called the Achilles tendon. And I find that in almost all the patients that I work with that have some problems with plantar fasciitis, we also see a very knotted up, a very tight calf muscle. And while we really believe in doing stretching for that muscle, which we're going to show you some of our favorite stretches in just a minute, I want to address just one thing just to help you understand a little more about what you might want to consider when you're trying to treat this condition on your own. So I want you to imagine that this elastic band here is the calf muscle. And this is like this elastic band. If you see this hook here, this is the tendon at which it would attach onto the base of the heel via the Achilles tendon. And what generally happens, and what we generally see for a lot of people who are struggling with a lot of calf tightness that also have plantar fasciitis, is that this calf muscle is like this elastic band that has a ton of knots that are just tied in the middle of the band. Okay, so what happens is if I tie a bunch of knots in the middle of the band, like so, what we'll see is that the overall length of the rope is going to shorten. And as the rope shortens, it's going to start to create a lot more stress, a lot more pull onto the attachment point. So the more stress that is applied to this attachment point, which is probably going to be your Achilles tendon and on your heel, this separation is what can start to create some form of stress and start to cause some inflammation, which could be at the root of what's actually causing some of your symptoms. And what we want to do here is just to show you a couple of ways where you can actually start to identify and target these little knots within the muscle to try to release some of those kinks and release some of those knots so that we can start to just naturally, simply relieve pressure from the muscle to create less strain on the tendon. So we're going to show you a couple of things on how to identify and release some of those knots, and then we're going to show you a couple of stretches to really fortify that technique. So let's get into the first release. Okay, so now that we've gone over the idea that there might be some type of muscle knots that are lurking in this calf muscle, which could be what's creating tension on your Achilles tendon, which could be causing just stress and inflammation on your heel, I'm going to show you an idea of the types of things that we might do for some of our patients here in the clinic in the form of some massage and trigger point release therapy and techniques. And these are definitely some things that you could also try on your own if you have a friend or a partner or a spouse or a boyfriend or a girlfriend that's willing to also kind of help you out with this condition. So the first thing I want to do is just kind of start with just a couple of just massage strokes up and down the calf muscle through here. And I don't want to be putting too much pressure here because all I'm really doing right now is just warming up the muscle, just getting a little bit of circulation into the calf. And then two, just also trying to identify where there might be some parts of the muscle which just feel a lot tighter or a lot more tender than some of the other spots, okay? Now, the thing with these trigger points, or the thing with these little knots, is that they're very easy to find if you look for them, because again, they're just parts of the muscle which just feel a lot tighter. They just feel like actual little knots, like little balls of tension, and they feel just different than other parts of the muscle that aren't as tight and aren't as in pain or as spasm. So I'm just trying to scan for some of these when I'm just kind of looking for where they are, and I feel one definitely kind of on this like mid to kind of inner calf through here, and I also feel a little bit more kind of on this kind of top portion towards towards the top of her calf muscle. So I'm just going to show you a couple of ways of how we approach the trigger point therapy, just so you have an idea of what to try, either if you're trying to do this on your own or have somebody that can kind of help along the way. So the trick with this type of massage technique is that we're not just trying to just beat the muscle into submission. We're just putting as much pressure as possible. There's a time and a place for that type of release, but I think for these types of trigger point releases, we want to approach with a different strategy, where again, instead of just kind of pushing as hard as we can, we just want to feel the tension within the muscle and just meet our pressure just to kind of meet the tension that we feel underneath the muscle. Because if you push too hard in some of these spots, what's going to happen is it's going to create too much pain, and the person will start to tighten. They're going to start to guard, and you're just going to start to enforce the behavior that you don't want, which is the muscle just kind of getting tighter. You also want to make sure that you don't, put too little bit of pressure, because it's just not going to do anything. So the goal is to put just enough pressure where you can start to feel the tension within the muscle, but make sure that you're not, again, creating too much pressure to the point where the person starts to kind of tighten in response to it. So right through here, I can kind of feel a sweet spot through there where I can start to feel definitely can feel the tightness within the muscle, but I also can kind of feel that it's starting to just kind of loosen under my finger the more I push. And the trick to trigger point work is to just be patient. When the muscle is ready to release, it's ready to release. You can't force it, you can't speed it up. The best thing you can do is just to make sure that you're putting the right amount of pressure, and just to allow the person or allow the patient be able to just slowly adapt and slowly react to that pressure over time. All right, this takes a little bit of time. This takes a little bit of practice. But again, I think that this is one of the definitely the best ways to release the kinks within that muscle, and to really speed up the process of getting that calf loose, to take pressure off of the heel, which will take pressure off of that plantar fasciitis area. So now I'm definitely starting to feel the muscle kind of releasing under my fingertips through here. So I just want to take up a little bit of the slack of that muscle, and then just push a little bit more pressure. Now that I feel that she can tolerate it, and now that I can feel that the muscle's really starting to loosen under my fingertips. Okay, so again, don't force it, don't rush it. Sometimes it takes 30 seconds. Sometimes it takes a couple minutes. The most important thing is just to stay patient, stay consistent, and just learn to wait to feel that release within the muscle. So, and we'll just do a couple of strokes just to kind of get a little bit of circulation into the area. Okay, so that's how to do a trigger point release. Okay, and the next thing we want to show you is how to use one of these little trigger point roller sticks here. This is another very effective technique that we use here sometimes in the clinic. And this is also something that I think it's easy for people to be able to work on their own. The hardest thing is it's hard to do on yourself. But again, if you have a friend or a spouse or a partner that's able to help, this roller stick is another really effective tool for helping identify where those knots are, and also getting a good release in those areas as well. So um, it's the same rules apply, where when I'm using this roller stick here, I'm just going to turn her heel a little bit. And you just kind of want to just start with a very, very slow scan of the muscle through here. And again, same thing, you don't want to make sure that you're not putting too much pressure or too much tightness to the point where the person's in pain, or they're just visibly guarding, because that's not going to do anything. And we're just doing a couple of rollers here just to get a little bit of circulation into the muscle, and also just to identify where some of those knots and some of those speed bumps actually are. So you can definitely feel a little bit of a speed bump, like right through here on this inner calf through there. But I also feel one, yeah, right up through here. I just feel there's definitely a trigger spot up through here. So I'm just going to show you how to release a trigger point using this little roller stick through here. And same rules apply, where I just want to kind of isolate that spot. And then once I kind of feel the little tight spot underneath the roller stick here, then I just want to just slowly kind of lean into that pressure and just kind of sit there and wait. And then from there, I can just do a couple of tiny little mini oscillations, and then just go back to just putting more pressure on that knot through there. Okay. Again, the trick is to just stay patient with it. The same rules apply with the using my thumbs and my fingers. It's just a little bit easier with this roller to apply a little bit more pressure. But again, the downside of the roller, I don't have as good feeling with my fingers, so I can't feel the muscle as well. But I can still feel the tension as it releases. And just a couple of small oscillations through there, and then yeah, after that, then there's essentially no speed bump through there. Nice and smooth, just really easy to just kind of roll up and down the roller through there. So That's how you can use the stick roller as a means of just releasing the tightness with the muscle, again, to take pressure off the tendon, which will take pressure off of the heel. So let's get into the next part of the video. Okay, so the next thing we're going to show you is how to do a self foam roller release on your calf. And again, the goal of this is to try to release some of the knots, release some of the kinks within that calf muscle to be able to take some of the stress, take some of the pressure off of the heel and off of the foot. This requires a little bit of upper body strength, and it's a little bit difficult to do. But if you're able to just practice it a couple times, it's one of the, again, most effective ways to be able to release some of those kinks on your own. So Tweet, go ahead and get into position. And what Tweet's going to do here is she's going to use her right leg just to put a little bit of pressure on her left foot to get a little more pressure on the muscle. And she's going to roll very, very slowly up her calf. And what she's going to be looking for is to find certain spots or find certain areas which feel a lot more painful and a lot more tender than the other spots. That's what we call the trigger spot. That is what it's called, referred to as a knot. And what people mostly do when they find these spots is they just kind of roll off the spots since they feel very painful. What Twee's doing here is she's doing a good job of just kind of controlling her breathing and just trying to gradually learn how to sink pressure into the spot to be able to unkink those areas. Okay. So, and this, again, this takes a little bit of practice. This takes a little bit of time, but the goal is to be able to identify where those trigger points actually are, be able to use your breathing and to be able to sink more pressure into the spot over time. And once you start to feel some release in the area, you can just kind of reposition yourself, and then just slowly start to work up the chain and work for another kink or another knot up the chain. Right. Breathing is the most important part about this exercise, and it is what will really help you train how to release some of those kinks within the muscle, and also to help deliver a better supply of oxygen into those areas which might be just kind of kinked up and really tight. 3, 2, 1. Good. And then you can show them how to kind of roll from side to side here. So once you start to roll up towards the meat of the calf, there's a lot more muscle on the inside and much more muscle on the outside. So you can actually start to roll your calf and roll your leg, just to see if you can find some more kinks on the side or more kinks on the inside as well. Okay. And let's show them one more time a little bit further up the chain. So same thing. It generally gets a little more tender once you get towards the top of the calf, but the same rules apply. Again, just takes a little bit of time, takes a little bit of practice, but very effective way to release some of those knots and to take some of the pressure off of your heel. Okay, and so that's it. And as a reminder, you always want to make sure that you try at least to do one round on the other side to make sure things are balanced, and to also make sure that you just kind of feel what it's like on the non-painful side. If there are some kinks or if there are some knots on the other side as well, make sure you take your time to work out those as well. So that's it for the self-roller. So let's get into the next exercise. Okay, so the first stretch is a very basic calf wall stretch. This is one of the most common stretches that is generally prescribed for this condition, but I just want to walk you through the correct form and the correct technique just so that you're able to get the most out of this stretch. So Tweet here, she's going to start by kicking her right ankle back. And I would say that the most common mistake, go and turn your foot out again, Tweet, is when people do this stretch when they have a really tight ankle, is that their foot will kind of rotate out here. So we want to make sure that your heel and your foot and everything is facing forward. And what people generally feel when they do this is just a lot more stretch and a lot more pull in the back of the calf through there. So just make sure your foot is straight. And also want to make sure that your hips are staying even and level, because sometimes a lot of tightness in the ankle can start to rotate your hip out as well. And what you want to do here is make sure that your heel is firmly anchored into the ground. And once you start to feel a stretch, you want to just kind of lean into the wall while making sure your ankle is also staying cemented into the floor. Go and straighten out your knee, Tweet. Perfect. And hold that for just a couple of seconds. Take a couple of nice deep breaths in. And you want to hold this stretch for a couple of nice deep breaths, okay? Make sure that heel is staying dug into the floor there. Make sure the heel isn't lifting. That's the most important thing, to make sure that heel is cemented into the ground. You want to be shooting for at least 5 nice deep breaths. We want to make sure that we want to use breathing to guide us through our stretching. To make sure that we are getting good oxygen flow to our tissue, and two, just to relax some of the effects that the nerves might have on the muscle that's getting stretched for the first time in quite some time. Perfect. Okay, let's switch sides. So we'll just show it again from the other side. So make sure that the heel in the foot is in the same line. So going to rotate that left heel inwards, Twee. Other way. Perfect. And make sure that heel is dug into the floor there. Take a couple of nice deep breaths in. Two more breaths. And last one. Great. So in this one, she's actually stretching the left heel, just for reference. And again, make sure you take your time. And you may not be as flexible as Twee here is in this video. So just make sure that you stretch up into your limit. Start to use your breathing just to learn how to adapt to that movement and just slowly progress over time. So that's it for the calf stretch. So let's get into the next exercise. Okay, so the next thing we're going to show you is how to do a very simple stretch. This is a really good stretch for not just for your plantar fascia, but all the way up into the calf as well. And we want to make sure that we're trying to address as many things as we can with each of these exercises. So all we're going to use here is just a very simple yoga strap here, which is just going to tie and just kind of strap on the top of her foot towards her toes. And she's just going to give a nice gentle pull all the way up. And once she starts to feel a stretch, and then this is a stretch for the plantar fascia structures on the bottom of the foot. It's a good stretch for the Achilles tendon and also into the calf muscle. But once you start to feel a stretch, just take a nice deep breath in and exhale and just push into a slightly deeper stretch once you get to that point. All right. And once you get to that point of tension, just try to hold it there for a couple of seconds. Just let your muscles just adapt to the stretch and just take a couple of nice slow breaths in. When you exhale, just push a little further into the stretch. All right. You should feel a nice pull in the back of the calf. You should feel a nice stretch, sometimes even in the bottom of the foot. Don't push as hard as you can. Just kind of go to your body's limit, and then just use your breathing just to kind of guide you from there. Let's do one more deep breath in, exhale, and just pull into to a nice little simple deeper stretch. All right, let's just show one round on the right side. So same thing. Hook the band onto the top of the foot, close to the toes, and just provide a nice pull. Okay, there you go. And then once you start to feel some tension, just hold it there for a couple seconds. Take a nice deep breath in, exhale, and then pull into a slightly deeper stretch, just like so. Give your muscles, give your foot and ankle just a couple seconds to adapt to the new movement. Nice deep breath in, breathe out, and just pull into a deeper stretch. Okay, so that's it for the yoga strap stretch. So let's show you into a more body weight stretch that you can do for the structures of your calf and your foot. Okay, this next stretch we'll show you is actually one of the personal favorite stretches of Twee here, because Twee has actually had some heel pain, plantar fasciitis in the past, and this is actually one of the stretches that she personally likes to do to help. So what she's going to do here, she's going to tuck her toes underneath, and what we're after here is to teach you how to stretch and open up some of the structures on the bottom of the foot. So Twee here, she's just going to, again, tuck her toes under, and all she's going to do is just kind of shift her weight onto her heels, just to put a little bit of body weight pressure onto her feet, just so that she can get a little more stretching, again, on the structures of the bottom of her foot. And from here, she's going to take a couple of nice deep breaths in, and breathe out, and just kind of slowly let all those muscles and all those structures start to stretch and release on the bottom of the foot. Let's just show it from a slightly different angle so we can just kind of see what that looks like. Okay. 5, 4, 3, 2, 1. Okay, so let's come back to this angle. So that's the level 1 version of it. Again, all you need to do is just hold it for about 5 deep breaths. And if you need to get off the stretch, that's fine. But she's going to show you what is the level 2 version of the stretch. So Twee, go ahead. So she's going to kind of rock her hips back. She's going to lift her knees off the ground, and this is going to amplify the amount of just force she's putting on the structures of the back of her foot. And again, the entire time she's just kind of keeping a nice controlled breathing pattern, because again, we want to make sure that we're getting a good supply of oxygen into those tissues and structures as we're trying to stretch and as we're trying to elongate them. Let's just show you from a different angle through here. Right, so you can see just quite a bit of pull, quite a bit of stretch on the structures on the bottom of her foot. Now, obviously, if you have any increased pain in the heel or just any increased discomfort in the area where you generally feel the pain, then just back off and just kind of stick to the level 1 version of the stretch. Okay. Okay. So did you want to complete the stretch? So here she's going to just kind of just slowly rock herself all the way back and just kind of go as far as she can. And she's been doing this for quite some time, so this is one of the things that she does to try to maintain. But again, just kind of stick around the level that you feel comfortable with. Don't force yourself to do everything, especially if it's causing pain. But this is just the types of things that you can progress towards over time. Okay, so you can go back to the starting point. All right, so that's it for the stretching of the bottom of the foot. Okay, so the next stretch is an alternative to the wall stretch, and this is just one of the personal favorites of a lot of our patients, just because it gets a little bit more done than just kind of isolating the calf, and you get a little bit of core activation, you get a little bit of hamstring stretching, and you're just kind of stretching multiple areas at once, and you're also getting some good progressive loading of some of those back tissues. So again, just a good all-in-one stretch and exercise for people that are in this phase. So Twee, go ahead and get into the position. So this is this is similar to a downward dog position in yoga, which is going to be starting on her hands and kind of making this V position through her hips. And we actually want to be obviously paying attention to her ankle and her calves. So right here, what she can do is just kind of do what we call these little ankle pumps, where she's just kind of bending one knee at a time. And when she bends one knee, she just kind of drops the other heel towards the ground. Okay, so you can start with just doing a couple of pumps, but once you are ready to engage fully into the stretch, just hold it down at the bottom and make sure that your feet are facing forward to make sure your heels aren't tilting off to the side or towards the inside, and then hold it for a couple of breath cycles. So let's do it again. So let's have you hold it for 5, 4, 3, 2, 1, and then switch sides, and just take like 3 to 5 nice deep breaths. Okay, 1, 2, and 3, and then switch sides again. All right, this is a nice exercise because you get to work on both calves at the same time, and you really start to also identify if you feel a lot more tightness or a lot more restriction on one side compared to the other. And go ahead and you can do both sides next. And you can also do both simultaneously if you just want to get both stretches done at the same time. But obviously, if you have more tightness or more restriction on one side, then you want to spend a little more time on the side that is restricted. Okay, let's show them the pumps one more time, Twee. So again, just have you hold it. You can count to up to either 5 nice and slow seconds, or I would recommend to count to at least 3 deep breath cycles, because we like to use our breathing to help guide us through our stretch, because it's a little more effective since we make sure that we get a good flow of oxygen into the muscle while we're stretching, which just makes it a little bit more effective. That's 2, and 1 more breath. Okay, and perfect. Okay, great job, Twee. Go and come back down. And what you might find when you're really tight is that it might be hard for you to straighten out your knee, and your knee might be a little bit bent, but that's something that you might want to work towards over time. Again, just be consistent with this exercise. Don't try to get it all done in one day, and just all we're looking for is just a slow progression of improvement over the course of time. So with that said, let's get into the next exercise. Okay, so this is a very simple strengthening exercise that you can do. I like this exercise a lot because it's very low impact, and it just helps you just create a little bit of healthy pull, a little bit healthy strain on the muscles on the bottom of the foot and through the calf, and also get some good strengthening through the glutes and through the hamstrings as well. So all it is really just a very slow, controlled backward step. We just want to be very methodical with this because you're also training your balance as well. And just like with the calf stretch, Twee's doing a good job of making sure that her heel is in line with her toe and that her heel isn't rotating outwards. So let's have you do it with the same leg a couple times. And another thing that she's doing is make sure that as she's planting her heel on the floor, that she's not letting the heel plant with any sort of impact. So she's just really controlling her heel as it's being placed on the floor. And again, we're getting a lot of good, healthy motion through the ankle, and we're stressing the ankle in the calf in a way that ordinarily isn't. And this, again, this is just one of a nice, easy way for you to start to reverse some of the effects of just sitting or just not moving your ankles for for quite some time in a way that's going to be very low impact and very low stress through your foot. Let's just show it one more time. So good job. Make sure that the heel is staying in line with the foot, and just take your time with it. There's no rush. Slow and controlled is the best. And if you have any pain in the heel or the plantar fascia area as you're doing this, that just might mean that you're not quite ready for this amount of stretch or this amount of load quite yet. You could even try to do with a pair of shoes on if you just feel the contact of the heel on the ground is a little bit too much. But otherwise, again, this is a basic starter strengthening exercise that I think is a good alternative to things like doing like heel raises or calf raises if you're just quite not ready for something like that. So that's it for the backward rear lunging exercise. So let's get into the last exercise for today. Okay, so this is the last exercise in our plantar fasciitis series, and this is the second strength exercise. This is good for just overall strength, overall balance, overall loading, but again, one that's less impact, and we're not doing too much, pinpoint loading on the heel. Again, we're just kind of teaching you how to activate and distribute the load across your foot, into your calf, into your hamstring, and just to kind of strengthen the leg all at once to teach you how to lift pressure off of your heel. So to get into the position. So just going to hold on to a foam roller here for balance. You can use a chair, you can use a table, just anything just to give you a balance, especially in the beginning. And she's going to just kind of take pressure off of her left foot and stand on her right foot. And then she's going to go into a bend at her hip, at her waist. And she's going to kind of bend over almost like a dipping bird. Go and bend that right knee a little bit. You want to make sure you don't do this with a locked knee, but also make sure you don't bend your knee any further than that. Just a soft bend of the knee should be completely fine. And just hold it for a couple of seconds. 3, 2, 1, and slowly go and pull yourself back up to the starting position. All right, so let's just demonstrate that a couple more times. Go ahead. So soft bend of the knee. All right, it's okay. Let's retry again. Soft bend in the knee. Again, this exercise is going to really challenge your balance, as you saw here. This is not as easy as it looks, but again, it's a very, very good, effective strengthening exercise when you get to a point where your heel can tolerate this amount of pressure on the base of the foot. Hold it for 3, 2, 1. Pull yourself back up very, very slowly. All right, and let's just show it one more time. Again, just by working your balance, you're getting good strengthening of the muscles on the bottom of the foot. Your calf, your hamstrings are working quite hard with this exercise. What's nice about this exercise is there's not too much pull, there's not too much impact on the heel or on the Achilles tendon itself. 3, 2, 1, pull it back up. We still get a lot of good healthy loading. You get a lot of good what's called eccentric loading of the muscles, which can really help improve the health of the tendon just by, again, stressing the tissue in a very healthy way, but not overstressing with things like jogging or things like impact, especially when it's not ready. So that's it for the Achilles tendon / plantar fasciitis rehab program. I hope you'd enjoyed, and we hope to see you again next time. Take care.